Hi, I'm Roger Mashad. At Franklin Templeton Investments, we believe that citizens need to be informed about the resources that can help make higher education more affordable. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Community Health Needs Explored, next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, Health Republic Insurance of New Jersey, MD Advantage Insurance Company of New Jersey, NJIT, New Jersey Institute of Technology, New Jersey's credit unions, banking you can trust, New Jersey Natural Gas, proud to support education in our communities, and by NJ Best, New Jersey's 529 College Savings Plan. Turn a dream into a degree. Promotional support provided by Commerce Magazine and by The Record, North Jersey's trusted source, and northjersey.com.
Welcome to Caucus, New Jersey. I'm Steve Adubato. You know, a series of community health needs assessments have been taken, and they found that obesity, heart disease, and diabetes are major health challenges that we face. Here in the studio to discuss what we can and, more importantly, what we must do about it, we have Linda Schwimmer, who is Vice President of the New Jersey Healthcare Quality Institute, Rich Miller, President and CEO of Virtua, Dr. Ruth Perry, Executive Director of the Trenton Health Team, and finally, Kathleen Noonan, who is co-director of PolicyLab at Children's Hospital of Philadelphia, otherwise known as CHOP. I want to thank all of you for joining us. By the way, you're going to see websites throughout this program, valuable resources where you can turn and get important information from nonprofit organizations. Rich, right out of the box, community health needs assessments. What are they? Why are they so important?
Well, we actually did a community needs health assessment with all of our partner hospitals, Cooper Health System, Kennedy Health System, and Our Lady of Lourdes Medical Center in South Jersey, in the Tri-County community, Burlington, Gloucester, and Camden County, to really find out what the community health needs were from the community, not what we think they are. What really are they from the community?
Did you have to do it?
Yes, we have to do it right now.
Who said, the government?
The federal government has said we have to provide a community health needs assessment. But if you really take this community health needs assessment seriously, which we're doing, it's how do you get underneath those chronic disease issues that you mentioned on the front end of the show, Steve, and really help the community understand how we get them well and better so they live a better life and a healthier life.
But I just want to be clear, as we talk about, it's diabetes, it's, is it heart disease?
Yes.
It's obesity.
Mm-hmm.
What else, doctor, are we talking about?
Cancer,
Cancer.
in particular breast, cervical, prostate, colorectal.
We found those things. And you're not surprised by much of this?
No.
No.
No, I'm not surprised. By the finding?
Yes.
No, I'm not that surprised by the finding.
Well, here's the thing. Now, Rich and Virtua did it with other institutions,
Correct.
Other healthcare institutions, hospitals.
Yes.
Did most hospitals partner with other hospitals to do the community health needs assessment?
Well, we received funding along with 5 other communities across the state from the Robert Wood Johnson Foundation to perform the community health needs assessment. In Trenton, we did it through the Trenton Health Team, which includes Capital Health, St. Francis Medical Center, the City of Trenton Department of Health, and Henry J. Austin Health Center, which is our FQHC.
A fairly qualified health center. Just to be clear, you run a nonprofit.
Yes.
You used to be, and if I get this wrong, you'll tell me, you used to be an emergency room physician?
That's true.
So you've seen it all.
A great deal.
Okay,
I
pretty
would
much.
never say all, but a great deal.
You've seen a lot.
Yes.
Now you run this nonprofit.
Yes.
Dedicated to?
Improving the health to make Trenton the healthiest city in the state.
In this community health needs assessment, you found what in particular as it relates to the Trenton community?
We have 5 priorities that were identified through our process. So one is safety and crime. That was number 1. The second was substance abuse and mental health issues. The third was obesity and healthy lifestyles. The fourth was health literacy and health disparities. And the last was chronic disease, in particular diabetes, cancer, and cardiovascular disease.
It's interesting. Every community is different. I don't know this for sure, Rich. I think I know your area pretty well. Crime not high on there?
Well, we're in Camden City. So what Ruth was talking about, we have the same issues in Camden City with that assessment. So the The issues were different by county and by location, so one size doesn't fit all with the assessment.
Okay, jump in.
Yeah, well, I think that the difference, I think, from CHOP's perspective is that our needs assessment really focuses on the kids. And so for the kids, they're slightly different issues.
Because you're a children's hospital.
Because we're a children's hospital. And so we are both paying attention to the needs of their families, because if they don't have healthy families, they can't take care of the kids. And then we're also really focused on the needs of the kids. And so issues of obesity,
Let's talk about that
asthma,
childhood obesity
yeah.
thing, which I also know is very big with the Robert Wood Johnson Foundation. How important was that?
Very important. I mean, not just in CHOP's assessment, but in Philadelphia, citywide, the health department has found that about 50% of children in Philadelphia are at least meet the criteria of obese. So it's very high. Now that doesn't mean that all of them are, are morbidly obese. I mean, there isn't, it's not an issue of, but at least at the lower scale, they are actually not as healthy as they should be.
But the things you can't and again, as a non-clinician, I just anecdotally, I'm just thinking this, help me if I'm wrong here, but you can't separate childhood obesity from other clinical problems and issues, right? Like if a child has a problem with obesity, he or she is likely to have problems down the road, potentially with diabetes. Am I wrong about
that?
That's
That's right.
correct.
That's right.
Okay, so jump in.
That's right.
Right. Well, I think what you're seeing is, and the head of the Robert Wood Johnson Foundation has a great quote. She says, your zip code has at least as much to do with your health outcomes as your actual DNA. And so you're going to see in Trenton, childhood obesity was a huge issue. I think close to half the children were obese. Whereas in the rest of Mercer County, there's a far lower, there's still child obesity, but the numbers are lower. And some of the things that are driving it, you're seeing, is like violence. So parents aren't, comfortable with having their children go outside to play. It's not safe. So what these community needs assessments do is they create a blueprint for how can a community start to tackle these issues and move forward. What are the things that are driving these health problems? And they really are societal, they're geographic, and so you need to pull together as a community to start working on those issues.
Let me play devil's advocate here. You get this information. Now, you say, doctor, you weren't surprised, but it is confirming a lot of important information, right?
Very confirming,
Okay, right.
very validating.
And Rich, you weren't surprised, but it is confirming and relevant.
Correct.
And you said before in an interview we also did today with you for our sister program, Capital Report, which you'll see with my colleague, Raphael P. Roman. The other part of this, from a public policy point of view, which Capital Report looks at, is that government has to be a part of the solution. Now, respectfully, I'm thinking about Trenton for a second. I'm not going to get into the mess as we do this program. And
Yes.
I don't even know who your mayor is today. By the time this program airs, hopefully there will be one. The point I'm making is this. Is it not the job of government, in part, to respond to this community health needs assessment and do something? I'm not saying it's all of them, it's nonprofits, it's healthcare institutions, it's others, et cetera. But doesn't there need to be a degree of political stability and responsiveness to take this information, Rich, and do something?
In a perfect world, Steve, in a perfect world, yes. But I get tired of health providers and other people in the community saying, it's their responsibility or it's somebody else's responsibility.
Well, whose is it, Rich?
It's our responsibility to take care of what we can take care of. In other words, if we can make a difference in certain parts of the health of the community, take it on. We should be taking that responsibility on to take care of chronic disease in the community. There may be parts, there's other parts I'm sure everybody could talk about around behavioral health, social issues in the community that are huge issues that we all have to be part of.
About crime and a whole range of other things.
Absolutely, and we have
education.
We have to do that.
But
do what you can, take care of something you can do something about.
Give us a concrete example where you say, you're not going to wait for the government in Camden County or Cumberland County to do something. You guys are going to do it.
I have care coordinators working with our primary care physicians in the city and outside the city to go into the homes in Camden and even outside of Camden. There's a lot of underserved areas in Burlington County and other parts of Camden County that we're actually going into the home and advising the community member of how to take their medications, how to eat better. So putting a plan together, a plan of care together for the community at home and not waiting for anybody else to do that. So how do we make those connections?
And that doesn't require government involvement.
Well, I mean, the other thing is that government is not typically the one that is providing service in the healthcare setting. Right? It's nonprofit providers, it's private providers.
Dr. Perry's organization, go ahead.
Right. And so it's when Rich, you say it's our responsibility. We're the ones that have the one-on-one contact with the families and with the individuals. And so government can provide some blueprint. It can give us a sense of the whole community outside of maybe some of the zip codes that we're looking at. It can change some rules to make some things easier. For example, allowing schools to be able to purchase healthier food. Right. But it's the school that's purchasing the food, right? So, I mean, there's a lot of direct responsibility on the ground.
Yeah, we can't wait. One of my point was, Steve, we can't sit back and wait if for everybody to get involved in taking on chronic disease in the community. I think if we do have a responsibility, let's take it on for what we can do for community members. That's the point.
But isn't there also a Trenton, if I'm not mistaken, isn't there a mayor's initiative in Trenton? It's not named after a particular mayor. It's the mayor's
wellness campaign.
The mayor's wellness campaign. But then, see, not in spite of what Rich is saying. No, but in there is something. I don't know what's going on, but there's something called that.
Yes.
Does that mean that requires the mayor's office to do that, or is it requiring healthcare institutions vis-a-vis what Rich was saying?
So the Mayor's Wellness Campaign is an initiative of the New Jersey Healthcare Quality Institute. And
your organization.
Right. And what we do is we provide a toolkit of ideas that we developed with Rutgers University in ways that mayors can engage in their communities. And so what we're doing now is we're looking at these community needs assessments and saying, this is what your community says it needs.
Any mayor.
Any mayor who's willing to work with us. We're not working with a mayor in Trenton right now, but we do work very closely with the Trenton Health Team. So I think that's an example where we're not waiting for government.
So you just proved Rich's point. Yeah. You're not waiting for a mayor to step up and say, oh, we heard you have a mayor's healthcare initiative. We want to be on board. You'll work with whoever is in place to deliver healthcare.
And so in fairness, the City of Trenton and their public health officer is a great partner. So we will find the great partner.
I just wonder why it's called the Mayor's Initiative, but go ahead. I'm sorry, go ahead.
I just also wanted to jump into, I think the other piece is, healthcare is a partnership. So it's between providers, patients, but it's also the community at large and government, and we all have to begin to come together. And so Dr. Moray from the Robert Wood Johnson Foundation has this initiative where we need to create a culture of health in our community. And
culture of health. Give us an example of that, because that sounds great.
So what we've done in Trenton, as we're slowly moving towards that, it's not something you're going to do instantaneously, but in addition to the work that our providers do with our patients, a lot of the things that he just mentioned, we also have a community advisory board of about over 40 organizations now that partner with us. They reviewed and were updated and participated and shared data for our community health needs assessment, and they have been involved in creating a high-level implementation plan for our community health improvement plan. And so that's outlining specific goals for the 5 priorities that I listed. But I also think that you can harness the CAB to also begin to address to policymakers that we need help on some of these issues that are intractable, some of these social determinants of health. So like transportation. So we've had issues where patients say, I have a primary care physician, I even have insurance, but I can't get there because public transportation is so poor, or private transportation is not reliable. So they may pick me up on time, but for the return trip, they don't show up. Or they limit how many people you can take with you. So if I'm a single mom with 4 children and I can only take 2 with me, I'm not going to leave 2 at home.
So in that case, what would you need government to do?
So we need to understand how we can improve transportation. How can we create alternative routes? How can we make private transportation companies more reliable, more effective? Trenton has been labeled as a food desert, so you can't find...
Food desert meaning there is not a place in an urban community
where they can
get healthy fruits and vegetables.
And fresh produce. And so, how can we begin to attract a supermarket or several supermarkets in
Right.
the area. We're also working with one of our partner organizations, Isles, who's I think also involved in the mayor's
Is that Marty
wellness.
Johnson's organization?
Yes,
It's
it
a great
is.
organization.
And so, yes, it is. And so, you know, they have begun to create healthy corner stores, and so
Yeah.
they've implemented 4
That's another
where they're
nonprofit, though.
beginning exactly where they're beginning to shift what's being carried in the store to make it more healthy. And they're also working within the Monument School and trying to impact food selection
lot of collaborations going on.
for through the school district and to do other things. So there are things that we can do individually for my health.
And
So
again, to Rich's point, you can't wait.
so you
Well, I
can't
think
wait. So
the
there are
point
things
Ruth-
I
yeah.
need to do as a patient. There are things that we need to do as a community. There are things that providers have to do. And how can we understand this and pull together as a community as well as individuals?
To Ruth's point, I just want to piggyback on what Ruth said because it's so important. First of all, in our community, the health departments, Burlington, Camden, and Gloucester County are partners. So they partnered with the hospitals in this health
What do you
assessment.
mean they're partners?
They actually worked with the health, they wanted to work with the health systems in the community to find out what the community need was. So when we develop a community health plan for the community, the health departments will be involved with us. But to the point Ruth made is very important. Get out there and start the process going, and then pull the partners in when you find you have needs. And we're going to have transportation is a great issue because in the city of Camden, you know, when our family health center, we go out and get the patients. We provide the transportations for the patients. Ourselves, Virtua provides that transportation so that patients can access primary care. But that's a partnership, a private partnership that needs to develop throughout all the communities because there are patients that have social needs that are shut into their homes and have no access. Because access was something that we found was a need of the community. They didn't understand the access points in healthcare, what was out there in healthcare, and then the financial need issues were another big issue.
You know, in the conversation I had with Rich for Capital Report, I asked him about the Affordable Care Act, you know, the ACA, otherwise known as Obamacare, and I said, you know, did that push any of this, the community assessment? He said, no, we would have done it anyway. We're supposed to do it. It's important information. But here's my question now for all of you. To what extent has the Affordable Care Act, otherwise known as Obamacare, impacted any of the work going on given the information that you've gotten from this community health needs assessment?
I mean, I think that I've heard the head of Blue Cross Blue Shield and a head of a local hospital in Chicago say we've never talked to each other as much as we have in the last couple of years. I think what the Affordable Care Act has done is basically said payers and providers, you need to get together and you need to think about how you can improve quality, reduce cost, and get at prevention. And so I think in that regard,
is the federal government forcing conversations,
I think
interaction,
they are
dialogue
not.
that's
They're
never
not
taken place
specifically enforcing conversations. I think they are incentivizing conversations.
I think they're incentivizing conversations today, and if it doesn't happen, they're going to force it eventually.
Right.
So let me give you an example. We have an initiative in New Jersey called the Comprehensive Primary Care Initiative, and it basically changes the way primary care providers work. They do exactly what Rich was saying, and I think they have one site there at Virtua where primary care providers are basically engaging more with their patients. They get paid extra for all of that extra engagement. They have nurse care coordinators, and they're expected to get better outcomes, and then they're going to share in that savings. And if this works, this is the way that the federal government is going to reimburse for primary care across the board, period. So we're starting out voluntary. These accountable care organizations are coming about. I think that's starting out voluntary. But we're very rapidly going to move to the way the largest payer for healthcare, which is the federal government, reimburses for healthcare. I think this is a rapid moving train. We're seeing this in New Jersey. In yesterday's budget address, the governor mentioned we spent $12 billion for Medicaid. And he said he wants Rutgers to talk to the managed care organizations, that's the insurance companies. Let's figure out a way to get a better program because we do not get the outcomes we need. And the insurance companies are going to have to start working with the Trenton Health team and the Camden Coalition, the other ACOs.
It's not going to happen. Rich, the other thing I want to talk about is, by the way, look at the different websites we have listed throughout this program to get valuable information. Interesting thing. Talk to me about, you've talked to our producers about frequent flyers in the ER, correct?
Yes.
Make sense of this because it's directly connected to what we're talking about right here. Who are these frequent flyers in the ER and why are you worried about them?
Well, the frequent flyers in the ER are the patients that come in continually with a chronic disease condition. So it could be anybody with congestive heart failure to diabetes, type 2 diabetes, that instead of accessing primary care or a medical home model, they're accessing the emergency room with for episodic care or using it as their primary care office. So, and it's a very expensive model in terms of care. And
are you trying to identify them?
We are.
Once you identify, okay, you're a frequent flyer. Usually that's a good thing. In this case, it's a problem.
We have 5 accountable care models we have at Virtua right now. Accountable care meaning we're identifying these patients and actually putting them into our primary care and care coordination model to care for them at home. And we're putting the resources there for that reason.
And the goal is to
have better care. It's a better process of care, better delivery model, and to lower the cost of inpatient services.
Yeah.
Jump
I
back
think
in.
we're doing the same thing at CHOP. I mean, a very small percentage of our children actually represent most of our costs. And so I think what people are starting to do more is really segment the population and say, segment meaning divide it and say, which is, for kids, most kids are healthy. That's the reality. But there are, there's a percentage of children who are not healthy and they drive a lot of our costs. And so understanding which ones of those kids need more respite, need more home services.
Sorry for interrupting. Rich is talking about frequent flyers in the ER. You're talking about frequent flyers for kids.
They can be frequent flyers in the ER.
Well, say you identify them. What do you do?
So we actually get a care, we're starting to put a care team together, understand why they come to the ER, understand if it's because they weren't able to get in touch with their specialist. And so they got nervous and they went to the ER. I mean, really start to understand.
Don't just treat, sorry for interrupting, don't just treat them like any other kid, because there's a reason why they're there that often.
Right, exactly.
Right, doctor?
Absolutely. We're doing the same thing in Trenton. We have, as we become an ACO, we are beginning to identify
accountable care organization.
Yes,
that's a whole different show.
And but we have been working with our, we call them high utilizing patients. And so we have found that
I like frequent flyers, but go ahead.
Some might
what do you call high what?
High utilizers of emergency rooms. It's the same concept.
Yeah.
High utilizers.
Costs a lot.
It definitely does. It costs a lot. But what we found in our emergency departments in Trenton, acute viral syndrome, substance abuse, mental illness, sickle cell crisis. These are all illnesses that are best cared for in a primary care setting. So can they be treated in an emergency department? Yes, but receiving episodic care is not the best way to do it. It's not holistic. You're not able to treat individuals long-term through an emergency model where you can build rapport, you can see them as frequently as needed for some of these other issues. So the emergency department is appropriate. You have chest pain, it's appropriate if you fell down a flight of steps and you've broken your neck. Those are appropriate emergency department visits, but there are many visits that are not appropriate, whether it's chronic disease, mental health issues. And so we're trying to do the same thing, creating a care management team with a nurse, a social worker, and community health workers to help individuals navigate the health system and receive the care they need.
As I'm listening to all of you, I think to myself, we do so many programs related to health care. And I never get tired of it because the problem is so complex and challenging and the stakes are so high. But in the couple minutes we have left, this is what I need to ask. You have so many people who say in such a glib fashion, hey, why can't we fix that whole healthcare thing? Why can't you fix the healthcare mess? And I'm listening to this conversation and it's so, I hate to use the word complicated, but it involves so many pieces, so many partnerships, so much collaboration, right?
Right.
Why can't you just fix it, Rich? You ever hear people say that?
Yeah. Oh, yeah. The community says it all the time.
Fix it.
Yeah. Yeah. And I think we're getting there, Steve. I think in the last 5 or 6 years.
Is there such a thing as fixing it? Isn't it an ongoing, constant collaboration?
Yeah. It's so and let me give you a bit of complexity that I see. And is in changing the culture of the primary care physician is one of the areas. If you consider primary care physicians love seeing their patients for episodic care, and we have to change the cultural mindset of the primary care doctor to say, it's okay to be a health coach. It's okay to care for the longitudinal care of the patient.
What does that mean?
Well, that means that, you know, I want my primary care physician to look into my background, do my history and physical, and say, here's what we see, and here's the things you need to do to change your lifestyle to get you in a wellness mode, versus I'm going to see the family physician for a head cold. That's the model that really has to change.
It's a different mindset.
It's a different mindset. And we're getting there's a lot of our primary care docs that are there, Steve. They're really getting the model, they're understanding it, and they're changing it.
Well, I just want to say this. I know I say that in all seriousness. There is no fixing per se, but for the people watching, I know that the people in the studio right now are working at it every day. And if you're the folks on the front line, we have a fighting chance. I want to thank all of you for being with us. Thank you very much.
Thank you.
We appreciate it. Great job.
The preceding program has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by the Healthcare Foundation of New Jersey, Health Republic Insurance of New Jersey, MD Advantage Insurance Company of New Jersey, NJIT, New Jersey Institute of Technology, New Jersey's Credit Unions, New Jersey Natural Gas, and by NJ Best. Transportation provided by Airbrook Limousine. Caucus New Jersey has been produced in partnership with TriStar Studios. This program has been made possible in part by New Jersey Sharing Network.
Hi, I'm Peter Rooney. In 2006, I lost my father to renal disease. He was on the waiting list for a new kidney, but did not receive one in time. Unfortunately, so many like my father have lost their lives while waiting for a life-saving organ. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and by informing people about this important decision, because you can make a difference and save a life.